Good morning and welcome to day 2 of the Embark Canine Health Summit. My name is John Ambrose and I lead Embark's professional services organization, a group dedicated to empowering veterinarians and breeders with genetic testing products and services to support the long-term health and longevity of dogs. I'll be your MC again today, and we're thrilled to have you join us as we explore the latest news from canine health researchers, hear best practices and advice from champion breeders, and use interactive chat sessions to engage with one another and ask questions of our speakers. If you missed day 1, complete recordings will be available next week on embarkvet.com, and please be on the lookout for email updates as well with links for how to access this content. As we discussed yesterday, Embark Veterinary is committed to improving the lives of dogs through a unique combination of applied genetic health testing and rigorous scientific research. Our goal in hosting this event is to advance the field of canine health by bringing together the many stakeholders who are critical to this mission: the veterinarians, breeders, researchers, and scientists who directly impact canine health. By working together, we can make a difference and improve the life and longevity of dogs. Now, given this is a virtual event with thousands of attendees participating from around the world, before we get to our first speaker today, I want to highlight a few tips for getting the most out of this summit. First, use the interactive chat feature. You can post comments and questions about the content you see being presented and interact with other attendees. And you can also ask questions of our speakers, who will all respond to at least some number of questions directly via their live Q&A sessions at the end of each talk. In addition to watching the presentations in the auditorium, you can visit other areas of the summit, including the barking lot, the science lab, the Embark booth, and the press room, to access a variety of expert articles and videos on various content, chat with Embark Veterinary experts, and much more. New for this year's Health Summit is a virtual scavenger hunt in which you can compete to win special prize packages. You can click on the gamification icon in the lobby to play. Additionally, for any questions or assistance you might need related to accessing and viewing the summit, as well as any of the features you see across the website, please visit the help desk. Lastly, registration will remain open over the course of the day, so you can invite anyone you know to sign up and join the summit at any time simply by sharing the summit link. So now I'm excited to kick off day 2 of the Embark Canine Health Summit by introducing today's keynote speaker, Dr. Autumn Davidson. Dr. Davidson obtained her BS and MS at the University of California, Berkeley, with an emphasis in wildlife ecology and management, and is a graduate of the School of Veterinary Medicine, University of California, Davis. She completed an internship in small animal medicine and surgery at Texas A&M University and a residency in small animal internal medicine at the University of California, Davis. She became board certified in internal medicine in 1992. Dr. Davidson is a clinical professor at the School of Veterinary Medicine at UC Davis in the Department of Medicine and Epidemiology. Dr. Davidson specializes in small animal reproduction and infectious disease and operates Clarion Reproductive Services in Three Rivers, California. Dr. Davidson also consults with the Smithsonian Institution National Zoological Park in Washington, D.C., and has authored numerous scientific publications and book chapters, in addition to being a renowned international speaker on a variety of veterinary topics. Dr. Davidson has traveled the world working with cheetahs, ring-tailed lemurs, and giant pandas in the field. She has been a breeder and exhibitor of Labrador retrievers since 1972 and also enjoys competing in conformation events and hunting trials. She also owns and enjoys working with border collies at home. Please join me in welcoming Dr. Autumn Davidson.
Well, good morning. Our topic for this morning is Controversies in Canine Reproduction. This presentation is aimed for both veterinarians and breeders, and I hope that it will generate some discussion amongst you and improve the outcome of breeders working with veterinarians. Well, if you're watching this, you must be a breeder or a veterinarian already seeing breeders and hoping to expand your practice, or a veterinarian that hasn't worked with breeders and is thinking about doing it. And I can tell you it's a great relationship and a great part of the practice that I had for many, many years. What is reproductive practice all about? Well, it's a very unique part of practice. It's rewarding and challenging. It's rewarding because it's very multifaceted. You get to do fun things like pediatrics and obstetrics, as well as medicine and surgery on all of your breeder patients. Clients tend to be very motivated and very compliant, great clients, gold clients, and they generate lots of referrals for your practice because they're producing puppies and placing them in puppy homes and usually referring the puppy homes to you as their veterinarian. However, repro practice can also be challenging, and a lot of veterinarians are very wary of taking on a breeder practice. Breeders are time consuming. They're very motivated to do the best thing for their dogs and cats, and that takes time. Unfortunately, they can also be very set in their ways. They can be very opinionated and unfortunately also exposed to a lot of anecdotal advice and evidence, usually on the internet or from other breeders or from their mentors. You need to have good credibility. And actually, it's ideal if you as a veterinarian are also a breeder, because then you have experienced these things firsthand and you can apply your scientific knowledge to the need for veterinary input on breeder issues. Unfortunately, also the technology for veterinary reproductive practice is not up to speed as compared to the human field for financial reasons. And even dog and cat reproduction is not always up to speed with big business bovine or equine reproductive practices because of the inherent value financially, not emotionally, but financially of their patients. There are species differences, so factors that are true in dogs may not be true in cats. Factors in horses do not mean it's going to work in dogs, etc. We're also dealing with a country that has a terrible pet overpopulation problem. And because of that, there's a lot of negativity sometimes about breeding dogs and cats at all. And we're also dealing with animals that have genetic disorders. And by creating purebred dogs and cats, we have created, by definition, inbred individuals. And therefore, the genes for disorders are much more commonly doubled up. And that's not to say that mixed breed dogs and cats don't have genetic disorders. They do, but we tend to see them representatively more in our purebreds. Well, here's some of the fun things that a breeder vet gets to do. They get to do all kinds of diagnostics. So not only just taking physical exams and doing blood tests and taking x-rays, but they get to do ultrasound. They get to do things like vaginoscopy. We recommend definitely pre-breeding examinations, and we'll talk a little bit more about that in a bit. Lots of different genetic screening tests, and thankfully there are websites that veterinarians can go to now for specific breeds and find out what the latest information is, what diseases should be screened for, and how they can be screened for. They get to do ovulation timing to predict the best time to do breedings. They get to do pregnancy or obstetric evaluation, workups for those individuals that fail to conceive, obstetrics, so illnesses during pregnancy. They get to do semen collection and evaluation for their male patients. More and more commonly, counties are requiring breeders to have breeding licenses, and those usually entail veterinary approval of their breeding animals being used for breeding. So that adds a whole new avenue where you have a chance to give good input to have the best husbandry for these animals. Pediatrics is an undeniably fun part of the repro practice. Artificial insemination is often necessitated by geography or by inability of a male to breed a female. And so you have to help Mother Nature out a little bit. We're now doing a lot of long distance shipping of semen rather than shipping bitches for breeding. We ship the semen to the bitch. So semen collection for shipping. Semen freezing has also become very popular with breeders, and this entails some special training, but it's really easy to do once you've learned. And then, of course, neonatal care, another great opportunity for fun in the repro practice. This is a great book to have. It's a paperback. It's available from Wiley Blackwell. Yes, I was one of the editors, but we had multiple authors, and it's a really great resource, both for breeders and for veterinarians. When I give this talk to veterinarians, they commonly do not understand a lot of the breeder terminology. And so I include this in their class notes so they understand what you mean when you say, this is an outcross. This stud dog covered that bitch. She had a miss. There was an inside tie. Well, we did an implant. She's finished. A lot of these terminologies need to become familiar to the veterinarian that's dealing with breeders. All right, this is a slide for both breeders and for veterinarians. Things to avoid and things not to ask your breeder vet for. So cosmetics, certainly, if you're asking for surgery to alter the appearance of a dog or cat, excuse me, for the purposes of going to the dog show or cat show and winning, that's not ethical, and it shouldn't be done. Veterinarians should not be willing to do cosmetic surgery, and breeder clients should not ask for it. Ear cropping and tail docking do come under this category, and most veterinarians wish that ear cropping would go away. Many of us weren't even taught how to do it in vet school. And the problem is now that there are very few veterinarians that can do a really good job of ear cropping. And so bad things are happening. It's being done incorrectly. It's being done by non-veterinarians. Let's all encourage judges to put up dogs with natural ears. Tail docking, again, I'm really glad I have a breed that doesn't have to have ear cropping or tail docking done to compete in the ring. Tail docking, I guess, it's really pleasant to go to Europe and see boxers with long tails. Again, that's a process that is legal now, but let's all work towards having the natural dog. Cryptorchid therapy. So cryptorchidism is a retained testicle. Instead of having two testes in the scrotum, there's only one or maybe none. There is no effective medical therapy for this, and it is in fact unethical to give any attempted therapy to have a testicle that's in the abdomen descend, other than tincture of time. The latest I've seen a testicle drop naturally is 14 months of age. So you can wait until that time has passed before doing an elective neuter on that individual for his health and for ethical reasons, because it is a genetic problem. Orthodontia, which is just like it is in humans, moving teeth around. It can certainly be medically indicated if a dog has a bad bite that's causing problems, but it should not be performed to make a dog with a bad bite compete in the dog show ring unless it's neutered. Orthopedic screening. This is a biggie with me. Doing hip x-rays without sedation is a wrestling match in 98% of dogs. They don't want to lay on their back with their legs stretched out and a weird loud machine above them. You get the best hip x-rays if your dog is sedated. It doesn't have to be a general anesthetic and just be sedation, but you're really going to learn what those hips do when they're stretched out if your dog is relaxed. So don't request radiographs without proper sedation, because you're not going to get the most accurate picture of your dog, and you're going to expose the technicians to radiation. They don't even need to be in there. It can all be done with sandbags, as seen in this image here. Performance enhancing medications. Well, obviously that's unethical. Home pharmacy facilitation. Lots of breeders like to keep a lot of medications at home so they can have them on the shelf if they feel their animal needs to be put on a medication, instead of having to make an appointment, wait for the appointment, get to the vet, and have something prescribed, or even by telephone have something prescribed. But it's not a good idea, because breeders aren't veterinarians and they don't always understand all the implications of putting dogs on drugs, and need to have guidance when they're doing that. So don't send home lots of drugs with your breeder clients, and breeder clients, please don't ask to have lots of stuff on the shelf that you can just use when you think it's right, because it may not be. We certainly don't support puppy mills. There's a lot of effort to control that, and veterinarians need to be part of the effort to control that, and those breeder licenses will help with that. and don't support bad breeding practices. So if a particular cross of a male and a female produced puppies with ectopic ureters, don't repeat that breeding. Don't repeat that breeding with anything similar to that breeding. Give guidance along those lines. What are our breeder clients' priorities? Well, first of all, they want to have a healthy dog that's an easy keeper, eats dog food, has normal eliminations, is energetic, not a dog with chronic illness. They want to have a dog that has the right appearance for their breed. And they ideally want to have the dog, if they're into conformation dog shows, a dog that can go into the conformation ring without a whole bunch of fuss, grooming, etc., and win. They want to have a dog that's a representative of the personality and performance abilities of that breed. So they want to have a Labrador that actually likes to swim and retrieve ducks without mauling them. Above all, they want to have dogs that reproduce easily. So bitches who get pregnant when they're bred properly, and stud dogs that get bitches pregnant when they're bred properly. They want to have puppies that are marketable because they have good temperaments and they're healthy. And they want to have fast fixes for heritable problems. And that's the one area that we're not going to be able to give them fast fixes in many cases. We have a single gene mutation that we can do a genetic test for, great. But many of our genetic problems are multifactorial, multiple genes involved, extraneous factors involved, and it's going to take time to breed away from them. I'm a big advocate of the pre-breeding exam, and this isn't your annual examination for vaccinations and heartworm medication and flea products. This is a specific exam done on the bitch or dog before they're used for breeding. This is the opportunity for the breeder and the veterinarian to communicate and educate one another about what expectations are and anticipate and avoid problems. And we call these the uh-ohs and the bad plannings. And it also is a place where veterinarians can feel more ethical about helping breeders produce puppies, because there is a huge overpopulation problem in our country. And this is the opportunity where you may be able to convince a breeder that they really shouldn't be breeding that individual. Well, the textbook pre-breeding exam involves, first of all, a complete physical examination, including examining the genital tract. So in a female, that means a digital vaginal exam. And if you're unable to do that because the female is tiny and she's not in heat, then you need to bring her back when she is in heat for that component of the exam, but the rest can be done. Listening for heart murmurs, looking for anatomic defects, malocclusion, etc. Temperament evaluation. So the dog that's hiding under the table and growling at you when you go to examine it is probably not a great individual to be bred. Discussion of breeding husbandry. So how are we going to decide when to breed? How are we going to breed? Are we going to do natural breedings, artificial insemination, shipping semen? All these things need to be discussed before the actual event occurs. Genetic screening. So again, can we do a hip x-ray and ascertain that this individual actually has hip laxity called hip dysplasia, and it should not be bred. So this is a phenotypic diagnosis. We don't have a genetic test for hip dysplasia yet, but we do have a good phenotypic evaluation. And then we have tests that actually look at the genotype. So what are the genes for retinal dysplasia? We can run a DNA test to find out if this individual carries them or not. Discuss about infectious disease screening for breeding dogs. And then special studies. Discuss how these should happen, ovulation timing and semen evaluation. I use a lot of client handouts because it really saves time and it gives the client something to go home and look at. I talk about things like steps for success with chilled semen breeding, but I also give handouts so they can go home and refer back to them. Talk about reproductive physiology. What happens in the estrus cycle? Why is doing progesterone or LH testing or both so important, or even just vaginal cytology? Then we discuss the what ifs. What if something horrible happens and you have to hand raise these puppies? Are you really sure you want to do this? These are the things that can go wrong. It's financially going to be expensive. You're not going to make money if you're doing breeding properly, or you'll be lucky if you break even. And then talk about some of the controversial topics, which we'll cover in the next few slides. Well, here are some examples of classic breeder bad planning. These are the things you want to learn to avoid. And these are the things that when I mentor veterinarians who want to start doing breeding practice, we talk about having this happen and the fact that you can avoid this by doing good client education during that pre-breeding exam. So we don't take a female, a maiden female, so a bitch that hasn't been bred, who's over 5, so she's already kind of in that category of not as fertile as she was when she was 3, and we decide we're going to do a frozen semen breeding. That's not a good idea, because frozen semen breedings by their nature are less successful than natural breedings or fresh chilled breedings. So we don't take this on unless you're absolutely determined that's the only breeding you want to do. So you have another female that has missed becoming pregnant several times, so she's not had puppies, and we're going to try a different stud dog. But oh, by the way, he's never been bred either. We don't know if he's fertile. That's not good. The stud has never been bred by this method before. Okay, well, we've decided he's gotten bitches pregnant with natural breedings or side-by-side artificial insemination, but we're going to chill his semen and send it off and see if that works. Not a good idea. Better to do a chill check first and make sure his semen looks okay 48 hours later before doing this breeding. And there's no experienced reproductive veterinarian available for either the semen collection or for the insemination. That's just such an easy way to have things not turn out right. More classic bad planning. And I'm sure if you're a veterinarian listening, it's doing repro, you're laughing because you've had these things happen. Well, we let them try to breed all morning out in the backyard, and it just didn't happen. Now we need an artificial insemination. Oh, and by the way, he ejaculated on the floor while he was trying. Well, that's not going to work out. Not till tomorrow, maybe. Well, it's on the internet, and it's holistic and organic and grain-free, and I really like the bag cover. That's an argument I get all the time. It is very frustrating. Trying to educate clients about the massive dog and cat product internet sales that go on in the country, and how to actually accurately evaluate products that you're going to put into your pets. Well, I did it because my breeder told me to. Well, maybe a great breeder mentor, but that doesn't necessarily mean that they're educated on this topic. We need a C-section today. I know you're overbooked already, but we need to come in. We need a C-section. We're counting from her breeding dates. She bred 4 times over 6 days. Well, as a veterinarian, you know that's not a very accurate way to determine a due date. Talk about that a little bit more. And realize that some of these supplements that are marketed on the internet and through pet stores can actually be quite detrimental to your pets. All of these things cause problems. Red raspberry leaves are commonly marketed to enhance pregnancy, and actually it causes uterine irritability and promotes resorption or abortion in bitches. Black cohosh is basically estrogen, and that's not good. Excessive calcium supplementation is in the prepartum period promotes the development of eclampsia. A lot of over-the-counter products that have very interesting labels are actually quite harmful. So really be educated purchaser of these products and tend towards not using things that aren't determined by a veterinarian to be safe. All right, some more uh-ohs. Well, we're doing a brucella test, a brucella screen, because we know that's an appropriate thing to do before our dog breeding. We do it, she's been in heat about 3 days, so we're going to do it today. That's the first day we could get an appointment. Whoops, her screening test is positive. Now, that doesn't necessarily mean the dog has brucella. Screening tests can be falsely positive because they can cross-react with other bacteria, like Pasteurella. It necessitates doing a more specific test that usually means you have to send it off to a specific lab that's going to do a more definitive test, and that's going to take time. So if she's ready to be bred and you just did your brucella test and it's positive, that means she can't see the stud dog. She can't be near him because she potentially could be contagious. So do the brucella test a month to no less than 2 weeks before you anticipate this breeding to happen. Well, stud dog is an experienced breeder and he's trying to breed her, but he just simply cannot achieve a tie. Well, you check the bitch and lo and behold, she's got a vaginal stricture. So this is a vaginoscopic or endoscopic view of a bitch's vagina. Her head is up here and her tail is down here. This is the opening of her urethra into her vagina. Her vagina is actually into her vulva, excuse me. Her vagina is between these two little holes ahead. This is a septate band. So this is a band of tissue that shouldn't be there, that goes from the top of her vagina down to the bottom of her vagina. And it in many cases inhibits natural breedings. Now, some sneaky dogs can sneak along the side of this. They will not be able to tie her, but they might ejaculate on the side of it and actually successfully impregnate this bitch. But then what happens? Her birth canal is obstructed by this, and so it ends up with usually an emergency C-section. So pre-breeding exam should always include a digital vaginal exam to make sure that this is not present. If it can't be fixed, then artificial insemination can be done to get pregnancy, and an elective cesarean section would follow. These septate bands are usually pretty easy to fix. The circumferential type of vaginal stricture are much more difficult to fix and tend to reform. So we don't usually recommend trying to surgically fix those. Are these genetic? We don't know. We don't know. But certainly the conclusion that a pre-breeding digital vaginal exam should be done should become very obvious to everybody now. Here are our two dogs. We're here for an artificial insemination because he's really tiny and she's really big. So we just decided we're going to do an AI. We made an appointment for that, but he's never had his semen evaluated. And lo and behold, his semen looks terrible. So don't wait till the last minute, till the breeding means is supposed to be happening to do a semen evaluation on your stud dogs. Even if they've bred in the past, if they haven't achieved pregnancy within the last 3 months, they should be checked. And it should happen before the bitch is in season, his intended bride. It should be before you spend thousands of dollars showing him and doing genetic screening. It's easy to do. Collect the dog, look at the motility and fresh semen, make a slide, look at the morphology, and get a sperm count. We have automated counters now that make it super easy to do all of this. A chill check is when you collect semen as if you're going to ship it. You prepare it exactly the same way, and then you keep the box in the refrigerator for 48 hours and keep looking at the semen to see how it's surviving. And if it survives for 48 plus hours, then yes, he's a candidate for shipping semen, chilled semen to a breeder across the country. If you're going to freeze semen, you definitely want to check it and see if it's good quality semen before you put it through the freeze, because inevitably freezing and thawing semen damages it. So it has to be super good quality to start with. And collecting dogs improves their performance. They get used to the vet collecting them. They like going to the vet. The vet gets used to what this particular dog likes to have happen so that he gives a good collection. Does he like to have a teaser bitch or not, etc. So practice makes perfect. Worth the investment. All right, we'll move on to some controversial topics. At UC Davis, we did a survey of what the most common health problems dealt with by breeder clients at the Veterinary Medical Teaching Hospital was over a year's time. And there's a long list of problems that breeders have to deal with. And these obviously all translate into problems that their puppy people have to deal with. But the number one was orthopedic disorders. So, and probably the number one of that is hip dysplasia, elbow dysplasia, and OCD. Epilepsy, seizure disorders, allergies. That's another big one. So many dogs, not just purebred dogs, but mixed breed dogs as well, have atopy, which is inhaled allergies. Food allergies and contact allergies, much less so, but inhaled or atopic allergies are very common, and it's a problem that definitely has a genetic basis. Cryptorchidism. So as we spoke about, testicles should both be in the scrotum. If one or both are not, that's a genetic problem. Fortunately, temperament problems. So we are seeing breeds and lines of dogs within those breeds that tend not to have the temperament that is meant to be representative for that breed. You know, a Labrador that's aggressive, or a Labrador that is difficult for the veterinarian to examine, that's not normal. Ophthalmic disorders such as cataracts and retinal problems, those are a biggie as well. And whole departments exist in veterinary schools for just eye problems. Same with heart disorders. So valve, mitral valve, tricuspid valve, dysplasias, tendency towards cardiomyopathy in certain breeds, that's a biggie too. And again, departments and screening is available. Some of those diseases can be genetically tested for, others of them require an ultrasound for phenotypic evaluation. Severe anatomic malformation, so extreme smesh face, extreme excessive skin folds, extreme bow-leggedness. Some of these breeds unfortunately have been bred to the point where they're really just not very functional physically, and they suffer because of it. And so we encourage breeders to not produce such extreme traits. And then inherited cancers is a biggie as well. So that was a list from the veterinary hospital. You ask breeders what they think the #1 health problems that are genetic identified are. Well, you ask about atopy, seizures, retinal disorders. What's this? Hypothyroidism. Well, this was a survey done by OFA, and breeders identified hypothyroidism as being the #1 genetic problem that they're having to deal with. So there's a huge discrepancy there between what the vet school found and what breeders believed. So hypothyroidism is a very controversial topic. From the dog fantasy perspective, it's a big problem, and it causes significant health issues, coat problems, conditioning problems, energy problems, training problems, and reproductive problems are all blamed on hypothyroidism. As far as veterinarians are concerned, it's not a common diagnosis. I mean, honestly, I probably diagnose one true case of hypothyroidism in a dog a year. It's not common. Unfortunately, many dogs are, when presented for evaluation, are already on thyroid supplementation. They've already been placed on it by a veterinarian who believed the dog could be hypothyroid because it's having issues with weight management. Much more likely that the weight problem is because it's being overfed. But if they present already on supplement, then they've been made hypothyroid because of feedback from taking thyroid tells your thyroid gland not to make thyroid. And so we've created what we call iatrogenic hypothyroidism if we put an animal on thyroid that doesn't really need to be on it. And then you have to wean them off in a stepwise fashion to be able to test them accurately. And if these dogs are being bred, that's not the best time to do something like that because they will become hypothyroid naturally before they rebound and develop normal thyroid status. I mean, they've been made hypothyroid by being on supplement. So why does this happen? When it does happen, what causes canine hypothyroidism? It is an autoimmune disease. So if it isn't caused by putting the dog on thyroid meds, which suppress their own thyroid production, it is an autoimmune disease. So there are actually anti-thyroid antibodies that attack the thyroid gland and cause it to atrophy. What are some of the risk factors? Well, we know this is a genetic problem, and we know that it's more common in certain breeds. And interestingly, these are the breeds that statistically have been shown to be more commonly diagnosed with hypothyroidism than you would anticipate based on breed popularity. And interestingly, I don't see a Labrador in here anywhere. And many Labradors are diagnosed as being hypothyroid because they're overweight. But these are the breeds that we tend to see more of the disease in than we should because they've got the genes. And it's more common in intact females that are middle-aged and of large breeds. In humans, it's a pretty straightforward diagnosis. They take a blood sample and they run these two tests. Free T4 by equilibrium dialysis, which is an accurate measurement of the blood thyroid level, and endogenous TSH. So TSH is the hormone that stimulates the thyroid gland to make thyroid. Way back up in the brain, in the hypothalamus, TRH tells the pituitary gland at the base of the brain to put out TSH to make the thyroid make thyroid. So it's a pretty straightforward diagnosis in people. If you're hypothyroid, you will tend to have a low T4-ED and a high TSH because the body's trying to get that thyroid gland to get back to work. Veterinary medicine has become a horrendously complicated test with multiple algorithms to follow to try to achieve an accurate diagnosis of hypothyroidism. But really, most cases of canine hypothyroidism, naturally occurring, genetically mediated, are obvious to the veterinarian on the physical examination and history. Heat-seeking, abnormal fuzzy hair coat, lethargy. On blood testing, they tend to have anemia that's not regenerative, so it's just sort of sitting there with a slightly low red blood count. Their chemistries often show high cholesterol, or they may be totally normal. If they do specific thyroid testing, then there are several tests that are usually run for veterinary patients, but here's that endogenous TSH. Here's the total T4. There's the free T4. They're all very accurate tests, especially if they're run together. And we have a test that is run in dogs called TGAA, which is thyroglobulin autoantibody. That's the antibody that attacks the thyroid gland. And so OFA has a registry that looks at this. If you want to have your dog registered as being clear for hypothyroidism, you have to do all of these tests so they can look at that TGAA as well. And that tells you that even if the dog isn't yet hypothyroid, it's got the antibodies present and it's going to happen most likely. Some of the glitches are that we can see artificially elevated thyroid levels because the tests measure both thyroid and antithyroid antibodies. So it artificially makes the total T4 high. And that's why we do that free T4. It's a little better diagnostically. It doesn't measure these antibodies. And we can see a low T4 if dogs are sick. So even if they have a horrendous hotspot that requires they be put on antibiotics and cortisone, their thyroid test will be artificially low. So don't check thyroid status on dogs when they're ill. It should be done when they're well. Well, what's on the internet? What is believed? Thyroid's thought to be the evil demon that causes all kinds of problems. Male infertility, poor sex drive, atrophy of the testes, low sperm counts, semen morphology problems. In females, failure to cycle, irregular cycles, loss of litters, and high neonatal mortality. There's a little star here because the only thing that we do recognize in bitches is that they tend to have prolonged interestrus intervals when they're truly hypothyroid. What's known? We know that hypothyroidism is not always accompanied by reproductive problems. There's absolutely no evidence to date that healthy dogs' fertility is enhanced by putting them on thyroid. So please be a sleuth. Don't just put your dog on thyroid because you think it's going to help. One excellent scientific study that was done several years ago looked at a series of proven fertile beagles that were then made to become hypothyroid because they had iodine therapy given that destroyed their thyroid glands. And they did become profoundly hypothyroid dogs with obesity and heat seeking and poor hair coats and thin skin and et cetera, but guess what? They were still fertile. So it didn't affect male reproduction at all. In women, we know that thyroid hormone does support some ovarian hormone production, so granulosa cell function, making estrogen. It also supports placentation or formation of a healthy placenta and normal interestrus intervals. The only thing we've recognized in dogs is that bitches tend to have longer interestrus intervals when they're hypothyroid. So food for thought. What about the genetics of this? Well, we do know that the presence of autoimmunity or thyroid autoantibodies does have a genetic basis, and this has been proven in beagles. So dogs with that elevated TGAA or thyroglobulin autoantibodies should probably not be bred. Here's another big topic, pre-breeding cultures. What's rational? Well, all breeding dogs should be screened for brucella. Stud dogs should be screened at least annually. If they're out and about, going to lots of dog shows and being exposed to lots of other dogs besides the bitches they're being bred to, they may want to have more frequent testing than once a year. Brucella can be transmitted through urine. So even if a dog isn't bred, even if it's a maiden or never bred dog, it can be exposed to brucella. So it's important that we catch this disease before breeding that individual. It's also a zoonotic disease. It can be, people can catch brucella from infected dogs. So it's a serious problem. But the stud dogs minimally should be tested annually, and every bitch that's bred to them should be tested before the breeding, within a couple of months of the breeding. And bitches, again, should be tested before their breedings, even if they're maidens, because it's not only sexually transmitted disease. When else is reproductive culturing rational? Well, if you're working up a bitch for infertility and you feel that she does have evidence of having infection in her uterus, not just normal flora, but infection, then culturing inside of the uterus via a transcervical sampling is rational. If you have a dog that you're convinced has infectious bacterial infection in his reproductive tract, then you should culture it, but realize that semen is not sterile. It comes through a normally contaminated urethra. So if you want to do a semen culture, you also have to culture the urethra and then compare the number of bacteria in those two cultures. And that's a very expensive test, $600 or $700 to do. Better to go directly to the organ that you're worried about infection in, i.e. the prostate gland via an ultrasound guided sampling, or the urine via an ultrasound guided bladder sample. But culturing semen can be very misleading. Here's something that we deal with all the time. It's frustrating. Pre-breeding vaginal cultures that are demanded by a stud dog owner before breeding will be allowed. Or some breeders even gotten to the extreme where they won't even let a male dog get around any female dogs. All breedings have to be done by artificial insemination. And that's really kind of tragic. But these are healthy, fertile bitches that are presented to you as a repro vet for a pre-breeding vaginal culture. So you try to explain why this doesn't make any sense, that there are normally bacteria present in the vagina and the urethra, that when the cervix is open, those bacteria get up into the uterus, and then the uterus clears them out after the bitch is out of season. So they can be found even in the uterus normally. Male dogs also have normal flora, we call it, normal bacteria that live in their urethra, in the prepuce, and their role is to prevent bad bugs from getting in or getting a foothold in the reproductive tract. And we know that we call them aerobic, so they're air-liking bacteria, gram-negative, gram-positive, that's E. coli, staph, strep, and even mycoplasma is part of the normal flora of the genital tract in dogs and bitches. So if you do a vaginal culture, it's going to come back positive. It would be abnormal for it to come back negative because they should have normal flora. But if it comes back positive, then treatment is going to be requested or demanded. And that's bad because treating bitches with antibiotics when it's not indicated wipes out their normal flora and makes them more prone to opportunistic bad infections, and also promotes the development of resistance of our antibiotics to bacteria. And we're ending up in a situation where some infectious organisms we can't treat with antibiotics anymore. Know that studies have been done showing that dogs and bitches exchange their flora when they breed. It has no impact on fertility, so getting pregnant, or fecundity, litter size. It has a function. And the inappropriate use of antibiotics such as this is hazardous to everybody's health. Fading puppy syndrome often is interpreted by breeders as meaning it's herpes. So herpes is a serious viral infection that can be 100% fatal in a newborn litter of puppies. But we've learned that if appropriate diagnostics are done with fading puppies or fading kittens, that it often is a bacterial consequence, not a viral consequence. And so better workups need to be done by reproductive veterinarians to ascertain what it is. You can do pre-breeding screening for herpes. You can screen a dam, a bitch, for the presence of antibodies, which means she's been exposed before. And adult dogs, when they catch herpes, which is highly contagious respiratory type infection, generally get the sniffles. They're not sick. It's sometimes not even noticed by an owner, or they notice that there's some sneezing for a few days and then it just goes away. But that will result in her having antibodies, which is actually a good thing, because if she has antibodies, should her neonates be exposed to herpes in the kennel setting immediately after birth, she will have the ability to give them protection through her colostrum immediately after birth, and they should not become infected. But if she's negative, then she doesn't have the ability to pass antibodies through her colostrum to her offspring, and they will be at risk for becoming infected with herpes at birth. And it can be present in the kennel, it can be a fomite, which means it's on your shoes or on your hands. Strict husbandry is very important then. So that kennel should not have dogs coming and going from dog shows. It should have the bitch should be in a very restricted, clean area for her whelping and immediate postpartum period, not exposed to dogs that have been out and about. There is a vaccination available in Europe for herpes. It's not yet available in the United States. I kind of hope it doesn't become available because it hasn't had good studies done. The only studies that have been done on it were done by the manufacturer, and there are a lot of questions about their results. So much better to screen your dogs if you're worried about herpes. If they're positive, you're likely safe. If they're negative, then adopt strict husbandry to keep exposure risks minimized. Again, if you're concerned that a litter is sick, you've lost a puppy, you don't know why, the timing of diagnosis is super important. These puppies need to be treated immediately. And oftentimes we acquire diagnostics, which is usually a PCR sample, a DNA sample. It can also be diagnosed by virus isolation, but that takes a long time. Or if you lose a neonate, have a necropsy or an autopsy done, and that can acquire tissues for confirmation of herpes. But if we're worried about herpes, we usually initiate treatment, period. And once we can't confirm it, then we can stop treatment. But if you wait a week, you can lose the whole litter. So getting a diagnosis and then starting therapy is very important, and we want to make sure that they're getting adequate fluids, glucose, nutrition. They may need to be tube fed. They may need IV fluids. They need to be warmed up. So the normal body temperature of neonatal puppies is about 98 or 99, and herpes survives that. If they get your body temperature up to 100, herpes doesn't survive that. So you need to warm the puppies up without baking them. It's very important you don't make them hyperthermic, but get their body temperature up to 100 by using exogenous heat. So an overhead heat lamp, warm water blankets, etc., and take their rectal temperatures and make sure you've gotten them up to 100. And then we can use antiviral drugs. The one that I've had the most experience with is acyclovir. It's a common drug used in people. It has to be compounded to the right concentration for use in small animals, especially our small-sized puppies. But we've had some success treating with acyclovir and exogenous heat in confirmed herpes cases. This is a biggie, progesterone supplementation during pregnancy. So progesterone is absolutely necessary to maintain pregnancy. It does three things. It makes the uterine muscle flaccid, so it won't expel the fetuses. It inhibits white blood cell function so that the immune system won't reject the fetuses. And it makes the uterus very glandular so that the placenta is supported and the fetuses will survive to term. So you have to have progesterone on board to maintain a pregnancy. And the way we induce abortion in dogs is by lowering the progesterones. There's been a lot of controversy about whether progesterone supplementation should be used in bitches that are losing their litters. Is it because they have what's called luteal insufficiency or hypoprogesteronism? Their ovaries are not making progesterone as they should throughout the length of pregnancy. But we've learned that this is very uncommonly the case. In fact, I don't know of a single confirmed, reported, scientifically supported case of hypothyroidism in the bitch, which theoretically would be probably an autoimmune problem at the level of the ovary. Sometimes when an abortion has happened or resorption has happened, if we measure progesterone, it could be low. But we've done studies now that have shown that the cause of resorption or abortion happens before progesterone levels fall. Progesterone levels fall once the process has been going on for a while. It's the chicken or the egg argument, but progesterone is not the chicken. One of the problems with using progesterone is it does have side effects, and it's not benign. It inhibits the development of normal lactation, so you may end up with a litter of puppies that survived, but you've got around the clock, every 2 hours feeding for 3 to 4 weeks for your client. And it causes masculinization of female fetuses if it's given at the appropriate time when the genitals are developing. And this is an example of a pup at surgery. This is a female pup. This is her vulvar area. And she has what looks an awful lot like a penis. And her problem was she was incontinent. Not only that, she's obviously not going to be a breeding individual. So using progesterone in breeders' litters where they're hoping to produce bitches that they can go forward in their breeding program with is risky. And there are alternative therapies. We advocate the use of a drug called terbutaline if uterine irritability has been diagnosed. And the only way to diagnose uterine irritability is with a tocodynamometer, which is what Whelpwise is. So it's a uterine monitor that says, no, this uterus is way too active for 6 weeks of gestation. We need to quiet this down medically with terbutaline. Ovulation timing. Hopefully breeders are getting a really good idea of the bitch's estrus cycle because it's a little bit complicated. But what we know is we can look at them and predict by measuring progesterone, which is the dotted line here. And early in the cycle, if we measure progesterone and we detect the day that progesterone suddenly starts to rise, that we can correlate that with something called the LH surge. The luteinizing hormone surge is what triggers ovulation. And it's the gold standard driving the bus, tells the whole rest of the cycle what to do. So from knowledge of the day of the LH surge, which is magically the day progesterone first rises, we can predict the due date. We can predict her fertile period, which is usually between days 3 through 7 after that surge or rise in progesterone. We know a lot. But one thing to remember is there's variability. There's normal variability. So if you say that LH surge or that initial rise in progesterone is always 1.5, it's not true. It could be anywhere between 0.8 and 3. Ovulation, we know, happens 2 to 3 days later. Progesterone could be between 1 and 8. And the fertile window, which is 3 through 7 days later, progesterone can be anywhere from 4 to over 20. So just looking at a progesterone of 11 doesn't tell you this is her fertile period. You must breed her today. You need to be doing serial testing and interpreting it properly. Intrauterine artificial insemination. There's a lot of controversy about this. So initially, the only way we could do insemination into the uterus was by surgery. And that's because we didn't have any equipment that allowed us to go way up the dog vagina and way up through the cervix. So the bitch's cervix is about at the level of her thigh right here. You really have to have a very specialized piece of instrumentation to get into the uterus in order to do transcervical work. We had to do surgery, and typically surgery is an abdominal exploratory, either a laparoscopy or a laparotomy, where you're using laparoscopic instrumentation to exteriorize the uterine horn and inject semen with a needle into the uterine horn. But then in Scandinavia, they developed a technique of inseminating foxes. It's a huge industry to breed foxes rather than waiting for the foxes to breed themselves and not wanting to do surgery on the foxes. They developed transcervical catheters. And in foxes, they actually do this by manually feeling through the abdomen in a sedated fox where the cervix is, and then guiding this instrument through the cervix into the uterine lumen. In dogs, thankfully, a veterinarian in New Zealand developed an endoscopic method of doing transcervical insemination. So she created a method that you can actually see exactly what you're doing. You can look on this wonderful monitor and see your catheter going through the cervix and see the semen going through the catheter into the uterine lumen. And this was the first transcervical technique developed in dogs. And now there are several companies that provide really wonderful endoscopic transcervical equipment for us to use. So some breeders tell me, well, my breed, they never get pregnant from transcervical insemination, so you have to do a surgical implant. And I just don't believe that, because if it's done properly, the semen ends up at exactly the same place. So if someone's had a bad experience with their sight hound, it may just be that they haven't worked with a veterinarian who's actually managed to get the semen into the uterus through the cervix, and it got put into the vagina instead. So what are the pros of surgical? Well, the one pro I can think of is that you can look at the uterus grossly and see if it looks healthy. We don't like biopsying the uterus when bitches are in heat because it causes an inflammatory reaction, but you can at least look and see if it looks like there's any cysts or thickenings or abnormalities. The cons are that it requires anesthesia, it requires surgery. There's a potential for bleeding, infection, stress. It requires handling the uterus, and the uterus may release prostaglandins, which are hormones that cause uterine irritability if it's handled. It definitely causes postoperative pain, and there's stress associated with going to the clinic and having surgery. And then drugs are given to deal with pain, and those are going to cross the placenta and be exposed to the fetuses as well. And nobody likes going to the hospital, having an IV put in, having a blood test done, having anesthesia induced, waking up in a clinic, and post-operative nausea. So you're putting a bitch through all of this for a breeding. And definitely it's more expensive than doing a transcervical insemination. What are the pros and cons of transcervical insemination? Well, performed properly, there's minimal discomfort. Bitches usually do not need sedation or analgesia. It's usually a quick outpatient procedure. Some bitches can be transcervically inseminated in 5 or 10 minutes. Some take longer if they're difficult, if they have a lot of folds in their vagina or their cervix is a little bit crooked. It can take a while, but usually it can be accomplished. It's less stress, no drugs, no surgery, and it's very easy to have the owner there observing and helping assist with having her dog stand on the table. The cons are you have to have a cooperative bitch. The problem with using sedation, other than you are using a drug that will get into the uterus as well and potentially expose the fetuses. But when you sedate bitches, they tend to like to lay down, and TCIs are done with bitches standing. If done improperly, it's potentially damaging to the vagina, the cervix, or the uterus. So it has to be done correctly and safely. And you can go to surgery if you need to. So if you can't get through that cervix and it's frozen semen, it's a waste to put it in the vagina. So some of these cases, if you can't get them, you can go to surgery and do a surgical implant. But in 98% of the time, maybe 99.9% of the time, TCI is accomplished by a practiced operator. How do you decide? Well, both techniques have successes and failures. Done correctly, the semen should end up in exactly the same place. I advise clients to think about, well, how will I feel if this breeding fails? Let's say it fails for some reason that has nothing to do with accuracy of the technique. It has something to do inherent with the semen or inherent with the bitch's fertility. But how will I feel if it fails and I put her through anesthesia and surgery? Versus how will I feel if it fails and she just stood on the table and had a TCI done? That's a deal breaker in many of the cases. Elective cesarean sections. This is currently another big controversial topic. So in veterinary medicine, we know that elective cesarean sections are done for a reason in many cases. So some of our breeds have a real inability to whelp or queen on their own. So it typically are brachycephalic, chondrodystrophic breeds like bulldogs, Frenchies, pugs. Many of them can't breed naturally, and many of them can't whelp naturally. They have a much higher than normal incidence of dystocia, usually difficulty giving birth, usually because of a mismatch between the fetal head and the bitch's birth canal, or the steepness of the pelvic canal. And many of them haven't whelped naturally in so long, we don't even have any idea if there are any that can whelp naturally anymore. And we also tend to see this with flat-faced cats. And we do elective cesarean sections with very small litter sizes, such as singletons, single puppies, or maybe 2 puppies in a breed, say like a German Shepherd that usually has 10 puppies. Those small litters, those puppies will grow really big, and they'll outgrow the ability to pass through the birth canal. So those are reasonable situations to do elective cesarean sections when you anticipate there's going to be a dystocia, and you know that the chances of a natural whelp are very small. But now we're seeing more and more elective cesareans being requested by breeders without true reason, other than they really would rather not go through the stress of whelping a bitch at home. And is this a good thing? Well, what's good about elective C-sections? All right. Well, it's pretty much a predictable outcome. So if you go to a veterinarian that does a lot of cesarean sections, and they've got their technique of anesthesia down, and they've got their technique of surgery down, and they've got their post-delivery resuscitation team trained and ready to go very proactively, yes, it's probably going to have a good outcome. But even in the best of hands, things don't always go well. It does promote doing ovulation timing, because you need to be able to do that C-section electively on the right day. Puppies that are born more than 2 days premature will not survive because they don't have surfactant, and there's no drug we can give that accurately produces surfactant, which is a solution in the lungs that enables oxygen exchange. We can't give bitches steroids and produce surfactant, and we don't have commercial dog surfactant available like we do in the human field. It does increase the role of the veterinarian in obstetrics and neonatology, which is usually a good thing. We know that cesarean followed by effective neonatal resuscitation can be very successful. It avoids emergency cesarean sections. It's usually cost effective. It's great for the staff, and it provides veterinary revenue. And this is an opportunity for the breeder to be involved in the resuscitation part of the whole regime. Emergency C-sections are by nature not as good. They're unscheduled, obviously. They land in the middle of an already full caseload, especially in COVID times. It's dependent on what staff are available. It's not easy to have one resuscitator per puppy when it's an emergency C-section and everybody's doing everything else. There's minimal pre-op prep. So because it's an emergency, there's a minimum, let's look at her, see if she looks okay. Let's do a little bit of blood work and let's go to surgery because fetuses are dying. By the fact that she's been through labor unsuccessfully, she's compromised. She's tired. She may have had blood loss. Multiple methods of delivery often result, which means some of the neonates had been delivered naturally at home, and some of them are delivered by cesarean section. And so this usually also means that the ones that were delivered at home have to go without mom for a while, and the ones that are delivered surgically have to go without mom for a while she wakes up. And it's usually much more expensive than an elective C-section. Some of the bad things about elective C-sections, well, it's, again, like a surgical implant, it's invasive. It's painful. Just ask any woman who's had a C-section. There's definitely anesthetic risk to the dam and surgical risk to the dam. Disasters can happen, even with experienced veterinarians and staff. There are risks to the fetuses because of anesthesia and compromise of the mom. Definitely stress to the mom, which may impact her maternal instincts coming out, her lactation. And even in the cleanest hospital, there's going to be some exposure to infectious disease. And then there's the potential for mistiming and producing premature neonates that will not survive. The bads, all drugs cross the placenta, all of them, anesthetic drugs, antibiotics, everything. All drugs end up in the milk as well. And then there's this concept of baby's first bugs, and this came from people, but babies who are born vaginally acquire bacteria and yeast from their mother's vaginas. They colonize their intestinal tract and their oral pharyngeal area with these bacteria and yeast. And just like normal flora, it protects from bad bugs. So when neonates are delivered surgically, they don't get those baby's first bugs. There's a loss of selection going on for natural whelping, and that's a big topic, but it would be so nice if we know we're breeding dogs that can whelp naturally. It's expensive. And again, we may see some impact on maternal behavior and her lactation because of the stress of going into a clinic and having surgery. And it's unnatural. Mother Nature knows best. Another topic having to do with cesarean sections is, should we have her spayed at the time of her C-section? So we're not going to breed her again, or she had a horrendous dystocia and we don't want to breed her again, or she's too old now, we're not going to breed her again, I want to get her spayed. Can't we just do it under the same anesthetic as her C-section? And reproductive veterinarians tend to say, no, don't do this. It increases surgical time. It increases time under anesthesia. The uterus is a huge glandular, well vascularized organ at the end of pregnancy, and it's removed. So that takes away more fluid from the dam. There's much more increased risk for postoperative hemorrhage, bleeding, and it increases the time that she's not available to her neonates. And I will say that my veterinary colleagues and I who do reproduction, pretty much the only maternal death we hear about are in bitches who have had cesarean sections followed by spay. So yes, it means she's going to have to undergo another anesthetic. And yes, it means you're going to have to pay for another surgery, but it's just not worth the risk. Unless her uterus is horrendously damaged or infected or irreparable, at the time of the C-section, we do not recommend spaying at the time of C-section. Okay, he had 2 testicles, but now we can only find 1. I heard there was a shot that you can give him. He's the pick of the litter, of course. No, there is no medical therapy for cryptorchidism that works. So we have no drugs that effectively cause an intra-abdominal or intrainguinal testicle to descend down into the scrotum. And as I said, the latest I've documented that happening naturally is 14 months. So you can give it some time. But in most cases, they stay in the abdomen and need to be removed surgically. Why? Because intra-abdominal testes have about a 30 to 60-fold increased incidence of becoming tumors. And of course, this doesn't usually happen until the dogs are middle-aged or older. And tumors can be functional, so they can make hormones like estrogen and make the dog ill. And more commonly, they can TORS. And so if they TORS because they've become big in the abdomen because they're a tumor, that's an acute abdominal emergency. And you end up at the emergency room needing to have an abdominal explorer to find this TORSed neoplastic testis. So here's the one that came out of the abdomen. This is the dog's scrotal testicle. You can see how much bigger that one got. So dogs that are cryptorchid should eventually have both testicles removed. The one, if any, are in the scrotum, and the other or both that are in the abdomen. Number 1, because of this complication of neoplastic transformation, and number 2, because it's a genetic problem. So even if you just remove the abdominal testis, he will still be fertile if he has one in the scrotum, and he should not be bred. So it's best to neuter them at the appropriate time based on our best recommendations now. So big breed dogs shouldn't be neutered before they're 18 to 24 months of age, so they're fully grown. And again, it doesn't usually become an issue medically until they're adult, middle-aged, or older dogs. Puppy vaginitis is really a misnomer. So this is the mucoid glop that people notice passing from puppies' vulvas or being passed when they urinate. And this is a common concern of new puppy owners that don't have a lot of experience come rushing into their vet. She's got some pus passing from her vulva. But puppy vaginitis is not really an itis, which means inflammation in Latin. It's a misnomer. So it's kind of a normal part of maturation in female puppies and probably caused by an imbalance of the mucoid part of their vaginal discharge and the aqueous or watery part of their vaginal discharge. So we usually see it at about 6 weeks of age, and that's, you probably would notice it as a breeder when they're younger than that if it's present, but when new owners are inspecting their puppies and trying to get them housebroken, they're kind of focused on this area. It progresses on to puberty at least. It can last longer than that, weeks to months. And they're otherwise completely asymptomatic. So they're not acting like they have a bladder infection. They're not incontinent. They're not straining to urinate. They're not impossible to housebreak, as you would see if the dog was incontinent from a plumbing problem. They're normal otherwise than having this mucoid glop. And that mucoid glop sometimes causes some dermatitis. So that's the other sign that clients sometimes notice. So the main thing to rule out is, could she have a bladder infection? Because if she has a bladder infection and it's not diagnosed, it could ascend into her kidneys and cause more serious problems. So veterinarians often will say, well, let's at least do a urinalysis and make sure her urine looks normal. It could be caused by a vaginal foreign body. Here in California, we get foxtails everywhere. But it could also be not so much mucus, but urine, and that could be present as incontinence if the puppy has a plumbing problem, such as an ectopic ureter, which we see here on this ultrasound image. Most good breeders would be very aware that they have an incontinent puppy by the time it's old enough to be placed. And in rare cases, it could be mucus from the initial heat cycle, but that's not very common. We don't know what causes it. Some kind of juvenile imbalance of the glandular epithelium, and it goes away. So the therapy is benign neglect. These puppies do not need to be put on antibiotics unless they have been demonstrated to have a bladder infection. They should be kept clean, so that's why I say baby wipes. Baby wipes once a day so they don't get an accumulation of that discharge in their perivulvar area, and give them time. The prognosis is very good. It's not associated with adult dog vaginitis. It's been theorized to resolve with spaying, and it's been theorized to resolve with puberty. But now we know it just resolves with maturity, because these two events are completely opposite. Puberty would be hormones, spaying is no hormones. So we do not recommend early spay on these individuals. It will go away on its own. Another topic that I want to get across is vulvoplasty. So there's kind of a recent trend amongst veterinarians to do vulvoplasty, which is sort of a plastic surgery of the perivulvar area. And they may look at your puppy and say, oh, it's got a redundant vulva. It's got more vulvar folds. I can't really see its vulva unless I lift all this skin up and look. But unless there's disease associated with their anatomy, that's not a reason to put a puppy through a vulvoplasty. Some veterinarians recommend it if you have a puppy that has recurrent urinary tract infections or bladder infections, thinking that there's probably a lot of bacteria harbored in this area. But I would certainly advocate just using baby wipes or disinfectant, human disinfectant baby wipes to cleanse the area and make sure that that's a real necessity, because vulvoplasty is a kind of major surgery. If, in fact, there is disease associated with it, if there's such a severe amount of inversion of the vulva and excessive folding of the tissues above the vulva that there is chronic infection in this area, then a vulvoplasty is a reasonable thing to consider. And it is a kind of a plastic surgery of the perivulvar area, and when it's healed and the hair's grown back, it's a much more normal looking vulva than it was when it was affected by perivulvar dermatitis. But I think these are being done a lot more commonly than is really truly indicated. So be wary. Make sure there's a real reason. And this is my slide for veterinarians. They really have to understand where breeders are coming from. Good breeders are interested in producing the best example of their breed they can. But their priorities are usually to get those puppies, to keep one, place the others, keep one, the best one in their opinion, that they can go on and compete with. And they're going to compete in conformation, obedience, field trials, hunt tests, agility, search and rescue, assistance therapy, dock diving, barn hunts, et cetera, et cetera. It's a huge industry. And that's usually why breeders are breeding. As an offshoot of trying to get that perfect dog that they can go forward in their hobby with, they're going to produce a lot of puppies. And good breeders are finding excellent homes for these puppies. Excellent homes. And the puppies are under a lot of demand. So these are not puppy mills, good breeders. So you have to understand that's what their motivation is. Purebred dogs offer the most predictable adult appearances and temperaments. So if you have children and you want a bulletproof dog, you're going to want to get something like a Labrador. If you like to hike and you want to have a dog that's going to turn out to be a great hiking companion, you're going to want to have a dog something like a Doberman that can hike with you. If you want a dog for protection, you're going to want something like a Rottweiler that people just look at and decide not to rob you. So they have a predictable outcome. Our mixed breed dogs can be absolutely wonderful, but it's a little harder to predict what their adult conformation and personalities are going to be like. And mixed breed dogs also get hereditary diseases, so it's not just the purebreds. And as a very famous and great geneticist said, and I quote, "Hereditary diseases result from the accumulation and propagation of specific disease liability genes." And so here's where veterinarians can come in and offer assistance in doing genetic screening and advocating for the use of dogs that are healthy genetically in breeding lines. All right, and I will be available for questions.
Hello, everyone, and welcome to the live Q&A with Dr. Autumn Davidson. Thank you very much for that informative presentation.
You are welcome.
So we have had a lot of questions come in. This is obviously a topic of high interest to a lot of our viewers across both breeders and veterinary spaces. So we'll get right into it here. And just to kick off, could you just share a little bit about yourself and your own background? What led you to getting into this field and being so passionate about canine health?
Well, I was born into a family of breeders. My parents raised Labradors before they raised kids. So I was born into that environment and started showing dogs when I was in high school, and it went from there. So being a veterinarian was always my goal, and being a veterinarian with a special interest in canine reproduction, easy next step.
Great. That's great. Okay, well, let's get into these audience questions. And again, as a reminder to everyone, any questions we're not able to answer here live, you're welcome to go over to the Embark booth and post them there. And we have a number of scientists and other experts available to answer them as best we can. But for now, the first question that came in, someone wants to show dogs but has no interest in breeding. Is a vasectomy legal?
That's an interesting question, realizing that a vasectomy may make your dog sterile, but it doesn't change their testosterone-mediated behaviors. According to AKC, neutered dogs can only be shown in certain classes. Whether they would define a vasectomy as being neutered, I'm not sure. It's a good question for AKC. But the only benefit of doing a vasectomy is that your dog probably can't get another dog pregnant.
Got it. Okay. So next question, I think this is in reference to a comment you made in your presentation. Isn't it a good idea to have some meds on hand for known repeatable problems to avoid the risk of losing a dog if you can't get to the vet in the middle of the night?
Well, that's obviously a concern for breeders who aren't near an emergency clinic or don't have availability of an easy access to a veterinarian in the middle of the night. The problem with home pharmacies is I have found that many breeders decide without consulting with the veterinarian that they would just go ahead and start using a medication. And sometimes they use medications inappropriately that actually can cause more problems than benefit. So it can only be a situation where you're able to consult with your veterinarian about using a drug that they're allowing you to keep on your shelf at home that isn't expired, is dosed appropriately, and isn't in conflict with some other medication that your animal may be on.
Got it. So there's a few questions about this next topic. I'll kind of combine two of them here. Is there a prenatal vitamin that you do recommend? What dog food do you like for pregnant female dogs and puppies? And another question said, what can help a bitch's reproductive health as a supplement?
Okay, great question. I prefer a brand of dog food that has been through, the company puts their food through feeding trials. That means they're not just using a kitchen to make up food according to a recipe. They are actually producing food and feeding it to their stock of dogs and cats, and then watching their lifelong health issues. And this way, if there's a problem with the food, it's discovered in those companies' dogs rather than in your dogs. There are only 3 companies that do this. It's Purina, Hill Science Diet, and Royal Canin. So when you read dog food labels and it says nutritionally complete for all life stages based on AAFCO standards, that's a chemical test. It has to say nutritionally complete for all life stages based on feeding trials. So become a sleuth, read those labels, and know that those are the only 3 companies that always do feeding trials. As far as supplements, if you're feeding a balanced diet that's nutritionally complete, when you add vitamins and minerals to that, you unbalance it. So it's not a good idea. The only supplement that has been shown by studies to help bitches with pregnancy is fish oil, salmon oil. And that has been shown by a good study to improve placentation. So that's the only thing I recommend being added to a balanced diet.
Great. Very informative there with understanding what's on the label and looking for that specific statement. So a few other questions here. When should the male have a pre-breeding exam?
Well, they should have a pre-breeding exam, which should include semen collection and evaluation when they're post-puberty. So in small breeds, that's earlier than in big breeds, but average about a year of age. Ideally, you should have an idea if your dog is going to have any reproductive issues before you invest a lot of time and energy in dog shows and genetic screening, etc. So usually around a year of age.
Got it. Okay. So there's a couple questions about C-sections. I think maybe we'll handle them separately here, one at a time. So the text is cut off a little bit, but if there's a planned C-section in order to extract puppies from a bitch with a serious stricture, how is that ethical or sustainable without perpetual dependence on intrusive medical technology?
Well, this is a good question and a hot topic. And we have concerns about breeds that we know can't breed naturally, can't whelp naturally, have such extreme body modifications, brachycephalics, that they depend on veterinary medicine to continue the breed. And in some countries, it's actually being legislated that if a bitch has a C-section, she can't be bred again. Is it good or bad? A lot of philosophy here, but I would say if a bitch has a stricture and she has so many other valuable attributes and genetic health that you have decided you want to use her in your breeding program, to me, that's a debatable fault. We don't know if strictures are inherited. No one has done that study.
Got it. Okay. Well, thank you for that. Obviously, a lot to consider on that topic. For this next one, not sure if this will be more straightforward or not, but elective C-section in a dog with an average litter size of 7, but carrying in excess of 10 puppies. So should that happen, statistically, more will survive with a C-section than a natural whelp. Do you agree?
I don't think we have statistics to support or negate that. It's definitely a concern when you have a huge litter and you have concerns that the uterus is just maximally distended and perhaps not able to generate good myomutual contractions. But this is like everything else, it's a judgment call. So it depends on your veterinarian, talented surgeon, good anesthesiology, good neonatal resuscitation versus home whelping, which is much more natural in your hands with neonatal resuscitation. And you may end up with a situation where part of the litter is delivered naturally and part of the litter has to be delivered by C-section, which is never ideal. So that's definitely one of the things that you need to consider an elective C-section for, an excessively large litter versus the same thing with abnormally small litters, which results in large puppies.
Got it. Let's see. I think related to, I guess potential breeding. How old is too old for a maiden bitch? I have Siberian Huskies.
That's a good question. I have seen 8-year-old Labradors have an absolutely natural sized litter, normal sized litter and natural delivery with good management. Certainly if you're breeding a maiden at an older age, she's got an increased risk of dystocia, and that would be a great indication for being sure that you're using the most advanced methods of monitoring her labor, which would be uterine monitoring or tocodynamometry or whelp-wise, along with handheld fetal Doppler monitoring. So healthy bitch, I don't have a problem with breeding her at 8, but again, you have to treat it like a 45-year-old woman having her first kid. A little more monitoring.
Got it. And now, next one, should canines with umbilical hernia be excluded from breeding programs?
Well, umbilical hernias are felt to be genetic, which is the bad. The good is umbilical hernias in puppies can be detected early on, and the breeder would then take responsibility for informed consent with the puppy owners and perhaps follow through with making sure the hernia is dealt with as needed. Some hernias are actually closed and all you're feeling is a little bit of momentum that was extruded before it closed. Some are open and actually can run a risk of having a loop of bowel come out through the hernia and cause an emergency. Again, this is where being a breeder and a veterinarian kind of helps. It's probably not the most severe defect that we have to worry about in breeding programs, but it is a concern. It is a consideration. So if you're going to breed a dog that has a hernia, then you have to make sure the puppies don't have hernias, or if they do, be responsible breeder and manage them appropriately.
Got it. So we're about out of time here. There's, a number of questions continuing to come in that, again, we can try to address either in follow-ups or through the, Embark booth. But Dr. Davidson, as a kind of a final item, is there any kind of key message or call to action you want to leave the audience with before we wrap up?
Well, I think on the topic of veterinarians and breeders, which is near and dear to my heart, we are doing our best at UC Davis to educate our veterinary students about canine and feline reproduction and encourage them to take interest in it. A lot of veterinarians are sort of afraid of reproduction because it's complex. Maybe they fell asleep during the repro class, but it's a fabulous part of practice if you get involved in it. And I'd like to encourage breeders to find veterinarians that are willing to listen to them and learn from their vast amount of hands-on experience. And breeders need to listen to the veterinarians who have the science behind their recommendations and work together. And one of my goals is to try to create interest in veterinarians who do reproduction having what I call the labor and delivery room. So similar to what women go to the hospital and they go into a labor and delivery room to try to have a natural birth, and they're right there at the hospital if they get into trouble. We should be doing this with our dogs and cats as well. It'd be a great thing to offer to breeders if they're concerned about whelping at home and having this, of course, it always happens in the middle of the night, having issues. If they could have a room in the clinic with veterinarians that can check in on them periodically to whelp their litters or queen their litters, I think this would result in fabulous outcome and a lot less stress for everybody.
It's fantastic. I couldn't agree more with that perspective and recommendation. So thank you again very much. This was a terrific way to start our second day of the Canine Health Summit with your keynote presentation. So thank you again so much. And for everyone in our audience, our very next session is actually directly relevant to some of Dr. Davidson's comments she just made about how breeders, veterinarians, and scientists can collaborate and support one another. So feel free to switch over to that next panel session, which will be starting in just a moment. And thank you again, Dr. Davidson, one more time.
You're welcome. Thank you.